Hi students, today we will see some of the common instruments which used in the obstetrics and which is commonly asked during the examination. They include, first one is Blake's double-ended uterine curette. It have two ends. One end is sharp, which is used for gynecological curette, and other end is blunt, which is used for the obstetric curette like D&C, incomplete abortion and evacuation of herediform wall. Second one is Sims curette. It is single-ended curette used to curate the endometrium for histological study in various gynecological diseases. This is Sims double-ended speculum. Double-ended speculum used to retract the posterior vaginal wall to expose the cervix and to clean the vagina following delivery. Inspect the vagina to exclude local causes for bleeding in APH and during a D&D operation, and also used in vaginal surgeries. Sims double-bladed posterior vaginal speculum is used to inspect the vagina and cervix in the OPD. The blades are of unequal breadth to facilitate introduction into vagina depending on the space available. That means narrow blade for the nulliparous and wide blade for multiparous. It retracts posterior vagina for complete visualization of anterior vaginal wall. Retractor must be used. Used in gynae OPD for following procedures like taking pap smear, insertion and removal of copper T, colposcopy, taking swabs, hysterosalpingography. Used in gynae operations like D&C, cervical biopsy, vaginal hysterectomy, fertility operation, repair of vesicovaginal fistula and hysteroscopy. In obstetrics, it is used to inspect the cervix and vagina after delivery and to detect any injury following delivery, to clean the vagina following delivery. This is Cusco Speculum, self-retaining double-bladed vaginal speculum. It is used in the OPD for routine examinations because of limited opening. Only few procedures like taking pap smear, insertion and removal of copper T can be done. This is the Salam Forceps. This instrument is used to grasp the cervix, usually anterior lip of the cervix. Long instrument with the gentle curves that line of vision is not obstructed. The tip of the blades have 3 to 4 teeth to hold and steady the cervix in procedures like insertion of IUCD, cervical biopsy and D&C, first trimester MDP with suction evacuation. Cervical biopsy for Wills operations, vaginal hysterectomy, posterior lip of the cervix is gaps for posterior colpotomy. Since the teeth are sharp, it is not used in pregnancy as it may cause cervical tears and laceration. Instead, Alice tissue forceps is used. Sims anterior wall retractor. Double-ended instrument with a loop at either end. The loops are placed on the angle to handle. It is used to retract the anterior wall to expose the cervix. This is the Salam Forceps. We have already seen the Salam. Alice forceps used to hold the cervix during D&C operation and vaginal surgery. The edge of the retractor sheath during the abdominal surgery. Then Thompson's uterine sound. 30 cm long angulated instrument with a handle at one end and rounded blunt tip at the other. It is marked in inches or in centimeters. Used to measure the length of uterine cavity prior to D&C, to measure the length of the cervical canal in uterine prolapse, diagnose uterine stenosis, sound uterine polyp, to differentiate between chronic inversion and fibroid. It's 5 cm from the tip and bent angle of 30 degrees. And also it is used to feed the misplaced IUCD. Cusco Speculum we have seen. This is the ovum forceps, non-crushing forceps which does not have a catch or lock in the handle. Used to handle the products of conception in incomplete, inevitable and missed abortion. Used to evacuate the placental bits and membranes in PPH. Used in MTP. Used in herediform mold to remove the residual molar tissue. This is myomectomy screw, useful in studying in the fibroma during its enucleation by screwing into the fibroid. So episiotomy scissors, as we all know, it is used to give the episiotomy. Cusco Forceps used to do the ARM, and in some cases we use this one to clamp the umbilical cord. This is an instrument used to clamp the umbilical because of better grip and effective crushing effect to occlude the vessels, and also for the low rupture of membranes. This is Wrigley's or outlet forceps. This is the keyline forceps, which is used in case of occiput or posterior presentations to rotate and bring the occiput in anterior position. This is the Babcock forceps. It is used to hold the fallopian tube or any tube-like structures. In obstetrics, it is the fallopian tube. Otherwise, in other abdominal surgeries, it is used to hold the intestine because it have no teeth-like instrument which is gently hold the fallopian tube. Dian retractor, broad-based retractor used in abdominal surgeries. In obstetrics, it is used for the LSES. Laminaria tent. It is a seaweed which imbibes water and swells it up. It inserted in the cervical canal, left for 12 hours. It also induces the release of prostaglandin. It is used as a measures of induction of labor, but nowadays the laminaria tent is not commonly used. This is a single picture of a laminaria tent. It's a seaweed. It absorbs water and swells when it is left on the cervix. Sponge halting forceps. This is the Hegas double-ended dilators used to dilate the cervical canal. It is a long, rod-like instrument with a gentle curve and tapering tip. It is used for dilatation of the cervix in procedures like D&C, D&D, Fothergill operation, hysteroscopy, cervical stenosis, primary dysmenorrhea. It can cause perforation if too much force is used. Very large dilatation can cause cervical incompetence. The number on them represent diameter in millimeter. Both sides are used with lower number first. It's the needle holder. As we know, it is used to hold the needles for stitching the episiotomy or any perineal tear. Non-tooth forceps. This is the mucus sucker which is used to suck the mucus from the infant's mouth and nose. This is the umbilical cord clamp. Thank you for listening. If you have any comment or suggestions, please let me know.